Hey everyone, my name is Kristen and my presentation is on Lyme disease. Here's a quick list that I will be going over. The causative agent of Lyme disease is Borrelia burgdorferi. They are distinct because of their spirosheet morphology and large size. Humans become infected by being bitten by an infected black-legged tick. Incubation period is the number of days between when you become infected with a disease and when you might start seeing symptoms. Early stage symptoms are produced between 3 and 30 days after a tick bite. A distinct symptom is the erythema migrans rash, which looks like a bullseye. If not treated early enough, the disease can progress to the second stage where cardiac and neurological symptoms occur. One example is facial palsy. This can be described as the loss of muscle tone or drooping of one or both sides of the face. The third stage develops after several weeks or months and is characterized by arthritis with severe joint pain and swelling in large joints and chronic neurological complications that are extremely disabling. As mentioned earlier, Borrelia burgdorferi is transmitted to humans through ticks. The life cycle of a tick is typically 2 years in length. There are 4 life stages within this: the egg, larva, nymph, and adult. To look at the life cycle in more detail, we can see in the first year of the tick's life it is either an egg or a larva. After hatching, the tick larvae are infected as they feed on small animals like mice that already have the bacteria inside it. The larvae continue to develop throughout this first year. The second year, the larvae molt into the nymph, and then they need to feed quite often, finding numerous hosts, including humans. The nymphs mature into adults while on deer, either turning into male or female ticks, and then they mate. The female will lay eggs on the forest ground, and then the cycle will begin again. Prevention of Lyme disease can be done by dressing appropriately while doing outdoor activities, for example wearing boots and long leggings, or using insect repellent like DEET. Check children and pets if they've been playing outside, and make sure to use an anti-tick medication on your pets. If you do find a tick, it's recommended to remove it carefully using a tool like tweezers or wearing gloves if you use just your fingers. This is because you can still become infected by tick feces or body fluid. For treatment, in the early stage, doxycycline or amoxicillin is administered as oral antibiotics. If caught early enough and given treatment, a full recovery can usually be made. In late-stage treatment, ceftriaxone and penicillin are the antibiotics used for Lyme disease therapy. The Bay Area Lyme Foundation states that there is no definitive cure for late-stage Lyme disease at this time. Antibiotics, either way, between oral or intravenous, are prescribed for an extended period. This concludes my presentation. Thank you for your time.